Hello all. I'll be discussing a case of a 40 years old gentleman who presents with palpitations for the past few days. Now, this was the ECG that was recorded when he was not actually having palpitations, but there was something in the ECG that needs to be evaluated, and because since this is a very bizarre looking rhythm that is going on, we need to understand few things about it, and we need to reach to the diagnosis in this case as well. The main question that arises is this ventricular tachycardia or not? And more specifically, is this a polymorphic VT or not? Because we know that a polymorphic VT is a very fast and a bizarre and irregular rhythm that leads to hemodynamic compromise and ultimately cardiac arrest. And if it is present, then it needs to be managed as early as possible. The issue of polymorphic tachycardia is arising in this case because the complexes shape looks like very bizarre and they do not follow a single morphology. So you can see a change in the morphology of these QRS complexes as well. And definitely look at the rate of these complexes. It is around somewhat 300 beats per minute. And because it is irregular, definitely with a very fast and irregular rhythm, there has to be something that needs to be managed and evaluated for. But the question is, because the patient is not having any symptoms and is having this rhythm, so do we need to manage this as early as possible? And if this is a ventricular tachycardia, then do we need a cardioversion or not? Now, usually these rhythms do not revert by themselves, and the drugs are also not that effective. And because of the rate, the myocardium will not survive this rate for long. So, we actually need a cardioversion if it's a genuine arrhythmia that is going on. But there are some hints in the ECG which needs to be carefully looked at, and that will lead us to the diagnosis. Now let's discuss these ECG features. The first thing is the sinus sign. Now what is this sign all about? So the arrow is pointing towards some QRS complexes which appear different from the other. So look at this lead. This is called a limb lead 2. And look at the complexes over here compared to the complexes above and below this and in almost all other leads. So this was a lead that has been highlighted over here, and we can see that this lead is obviously very different from the other leads. So what is actually happening over here? So the thing is that if it's healthy QRS complexes with a normal heart rate, so how come it is possible that there are two rhythms going on? So this means that this was a sinus rhythm that was going on with a perfectly regular intervals and a healthy looking QRS complexes, and above and below are something else that producing these complexes. So always look at all the 12 leads before giving the final diagnosis on the rhythm. So this is the learning point that is very important in this case, and that's almost clinches the diagnosis. So this is called a sinus sign because in these all irregular fast rhythm, we can see a healthy looking QRS complexes that are firing at a normal rate, and most importantly, they are in almost every part of this lead. So we cannot see these bizarre, fast, irregular complexes anywhere in this long lead too. So this means there is also a sinus rhythm going on along with all these things. Now let's move forward. North sign. North sign is a sign in which we can see that there are some complexes which are showing the notches and some complexes are not showing the notches. So whenever there is an irregular rhythm and a fast polymorphic rhythm, then always look for these notches. They can help you. So what does these notches suggest? So these notches are usually seen alongside the cycle length of these QRS complexes of the sinus rhythm. So here you can see this is a QRS complex, and we can see a very good notch in the QRS complexes. While over here we can see that there are no notches whatsoever. So whenever there are notches, be wary of the QRS complexes which are merging kind of in these complexes. So this is a bit of a difficult sign to understand, but should always be looked for when you are looking after these fast QRS complexes and you want to reach to the diagnosis and a concrete diagnosis. Now, then, given an opportunity, always look at the end of these rhythm, this irregular rhythm, and look at when it becomes a healthy normal rhythm. If there is an evidence of that, in this case, we managed to get the end of this rhythm, and this was the slide for that. And if you can see that, look at the end of these QRS complexes. How have they ended? So we can see that this is an abrupt ending. So this was a fast rhythm and this was a slow rhythm over here. You can see that in the lead, AVR, and all the chest leads as well. So this appears to be matching with this long lead 2 rhythm. So we can see a very good QRS complexes coinciding with these long lead 2 complexes. So this means definitely this rhythm has kind of ended over here. Look at the end of this rhythm. So it is a very unusual ending. So it doesn't happen. So if it's a ventricular fibrillation for that purpose, this should not end like this. It never happens. So, and look at these very bizarre and rectangular shape complexes before it goes to sinus. So what is this all about? So this means that this was actually not a genuine ventricular fibrillation or a ventricular polymorphic VT going on. This was the diagnosis of artifacts. So these were actually the artifacts that were being shown in almost all the leads except the long lead 2. And the most important point to understand is that always have a limb leads whenever you are recording such type of rhythms, because just a single lead can help you reach to the diagnosis and avoid the inadvertent management of the patients. So this patient was not having any arrhythmia and he was just discharged home well, and on the follow up as well there were no arrhythmias recorded. So this was the main learning point in today's ECG. So what pearls to take from this ECG? First of all, always look at the signs, which are the sinus sign, the notch sign, and there's a sign called a spike sign. The spike sign means that we can see sharp spikes within these fast QRS complexes of these artifacts. And whenever you can coincide them with the cycle length of the QRS complexes, then try to look for the sinus QRS complexes which can help you reach to the diagnosis. The next point is the absence of hemodynamic compromise. This is very important. So whenever you are finding these bizarre complexes which looks like a VF or a polymorphic VT, usually the patients are having symptoms and the hemodynamics are not good. So if you can find a normal hemodynamics and asymptomatic patient, be wary of these artifacts. And finally, if given an opportunity, always try to look at the start and the end of these rhythms, which definitely helps you a lot and adds up to reaching to the correct diagnosis in this case.